Close out, come back in.
Hi, everyone. We will get started in just a couple minutes. We're working on getting our presentation set up. So thanks for your patience.
So the problem, and I've done that already.
Okay, thank you.
I've done that already. The problem is the link.
Hi, everyone. Thanks for joining. We're just working on getting the PowerPoint pulled up. So just thank you for your patience. Hi, everyone. We're just working on getting the PowerPoint pulled up. Just one moment. Thanks for your patience. Hi, everyone. We're just getting the PowerPoint pulled up. So thank you for your patience.
Delaney, can you hear me?
Yes. Hi. Thank you. You have it up. That's perfect. Thank you, everyone, for your patience. Welcome to our November edition of the BayCare Presents. My name is Delaney. I'm filling in for Jean Marie today. Today we have Dr. Jessie Stem here presenting about better back health. Just a reminder that this will be recorded and up on our BayCare Presents website afterwards. And if you have any questions, please put them in the chat and we will get to them at the end. So without further ado, Dr. Stem, thank you for being here and go ahead and take the floor.
Thank you. You can still see my screen?
Yes, go ahead and minimize the Teams page.
Okay.
So that we can see your PowerPoint.
Does that get it?
That's perfect. All right,
All right,
let me
good
start the
afternoon.
recording real quick. Okay, looks like it's going. Perfect. Go ahead.
Good afternoon. Thank you to BayCare for giving me the honor and the privilege of presenting. I wanted you guys to know, Delaney, ideally, if possible, I'd like for this to be interactive. But the only thing that I can see on my screen is my presentation. So if somebody's waving or somebody's raising a hand or something like that, I might not really be in a position to see it.
I'll let you know.
Okay. Today's topic is better back health, understanding and maintaining a healthy spine. Some of the content we're going to cover, back pain has a big impact on our economy, socially, economically. Um, so we're going to talk about some of those factors. I'm going to hope to present an understanding of some of the anatomy of the spine. We'll talk about disc degeneration and its impact on back health, some preventative stretches and exercises to try to help maintain a healthy back, some activities or habits to avoid to try to prevent back injuries. We'll talk about certain conditions that affect the spine and also some treatment options. Back pain is both prevalent and relevant. Back pain is one of the top 3 reasons why patients go to see a doctor in the United States. It's the number one reason why employees miss work in Great Britain. And interestingly, 3 of the 5 most common malpractice claims are related to either back diagnoses or back complaints. Some of the anatomy of the spine, I'll try not to overwhelm you, and I hope I don't bore you to death. The spine consists of 33 vertebrae divided into the cervical, thoracic, lumbar, sacral, and coccygeal segments. So there's 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae. The sacrum is really a part of the pelvis, but it forms like the base of the spine. But there are 5 sacral vertebrae that are fused together. And then your tailbone, which is also called your coccyx. Usually there are 3 or 4 segments in your tailbone. I sometimes talk about when God designed our spine, he gave our spine a difficult challenge, which is to protect the spinal cord and the nerves, support the head and the arms and the chest, and allow for movement and flexibility. And if you think about all those tasks, it's like, which master do you serve? If I wanted to protect the spine, I would think about something really robust, almost like a turtle shell. Um, but then that wouldn't allow for flexibility. So it's interesting how the spine really has a tall order to allow for movement and protection and flexibility. The intervertebral disc, the discs act as like a shock absorber between the vertebra. And the disc allows for movement, but it also contributes to some of the stability of the spine. Ligaments and muscles, ligaments actually connect bones or connect the vertebra, and then the surrounding muscles support movement, strength, and posture. They also play a role in maintaining spinal health. But ligaments are strong connective tissue that stabilize the spine. They help maintain alignment. They also serve as like a check rein to limit excessive movement. Obviously, too much movement could lead to issues in and of itself. And then, of course, the spinal cord and the nerves. The spinal cord serves as the main pathway for carrying signals between the brain and the body, which allows for muscle control, sensory perception, and these things are necessary for coordinated movement and reflexes. Nerve roots, they emerge from the spinal cord. They branch out into various parts of the body. They play a critical role in relaying sensory information as well as controlling muscle movements. And this, of course, impacts our overall mobility and function. So, spinal cord health and nerve function are vital for just doing simple things, maintaining balance, coordination, movement, living. An impairment of any of the components of the spine can lead to neurologic issues, which can, of course, affect daily activities, quality of life, pain, your ability to work, be gainfully employed. Um, so the importance of spinal health, maintaining spinal health is crucial for performing daily activities efficiently. A healthy spine supports proper posture, It reduces the risk of injury, it enhances mobility. It allows individuals to engage in work, exercise, leisure, and hopefully, with a healthy spine, you can do these things without pain or without discomfort. Well, I want to talk a little bit about disc degeneration. Disc degeneration refers to the gradual deterioration of the discs, which leads to a loss of the spacing or the height of the disc. The discs also lose elasticity, and then they have not as much ability to absorb shock. Um, as the discs degenerate, this causes formation of bone spurs, which can affect spinal stability and mobility. Um, in addition, as the discs deteriorate, it's just less health. The disc is less healthy and less robust. It's more prone to rupture or herniate. Um, I also want to take a little bit of time to talk about just the term degeneration. So, a lot of people are familiar with the word arthritis. And normally, when we talk about arthritis, we're talking about arthritis in the joints. So, hips or knees, shoulders, and arthritis in the joints really talks about when you have thinning of the cartilage. So when you get thinning in the cartilage in the hip joint or the knee joint, that process is called arthritis. In the spine, we don't use the term arthritis, although that's not incorrect. We just use a different term, which is disc degeneration. So degenerative disc disease really is just a fancy term for arthritis in the spine, but we're not talking about thinning of the cartilage. We're really talking about thinning or degeneration in the discs. There are certain risk factors for disc degeneration. Sedentary behavior, nicotine, obesity, and poor posture can all contribute significantly to disc degeneration. Um, it's interesting, nicotine actually cuts down on the blood supply to the disc. So people often wonder how is nicotine involved? It has to do with the fact that the discs already inherently don't have a very rich blood supply. Um, and so then if nicotine is it's a chemical which um, uh, constricts the blood vessels that bring blood supply to the discs. So that's how nicotine is tied into that. Um, but these factors place additional stress on the spine, which accelerates wear and tear on the discs, increases the likelihood of developing degenerative disc disease. The effects of aging on the spine. As we age, the discs lose hydration or they lose water content, which leads to them being less elastic. Um, this is a normal part of the aging process, but in and of itself, that also plays a role in the process of disc degeneration. So, what are the consequences of degenerative disc disease? Um, Individuals with degenerative disc disease can experience back pain, stiffness, um, limited range of motion, and these things can develop and cause significant limitations in daily activities and your overall quality of life. In addition, if there's nerve impingement involved, this can be particularly disabling because of the severity of the pain that can be associated with the nerves being compressed, along with the nerve dysfunction. So, there are some preventative exercises to try to help maintain a healthy back. Regular exercise promotes flexibility in the spine. This reduces stiffness, helps with range of motion, and these things are essential in maintaining posture and preventing injuries. Um, Engaging in exercises that target core muscles provides stability. It helps support the structures around the spine, which also helps to reduce the back pain. This is done so by distributing loads more evenly across the spinal column. Physical activity increases blood flow to the spinal tissues. This allows for nutrient delivery, removal of waste, and this helps in the healing process and the overall health of the spine. Some stretches that really most people can safely do these. There's a stretch called the cat-cow stretch. It involves alternating between arching and rounding both your back and your neck. Um, and this promotes flexibility. It helps relieve tension. Um, and this can be helpful in preventing discomfort. Um, Strengthening your core. And again, some of these can be done in a more limited fashion, but to strengthen your core, uh, exercises such as planks, bridges, abdominal crunches, these target the core muscles, which help with stability and support for the spine. And this helps promote better alignment and better function. Um, and when you get into doing a core strengthening program, you gradually increase the intensity and the length of the time that you're doing the exercises to kind of build up your endurance and continuously challenge the muscles. This fosters strength gains, which promotes long-term improvements for stability and back health. And then certain things to avoid. There's proper ways to lift and there's improper ways to lift. But bending at the waist instead of at the knees can put excessive strain on the low back. This can lead to disc herniations. Twisting movements while lifting or reaching can also lead to muscle strains or ligament injuries. Um, and this can especially be true in patients who have pre-existing back conditions or poor core strength. Um, Extended periods of sitting, especially with poor posture, can contribute to spinal misalignment and muscle fatigue. Um, this reminds me of, one career that really has, uh, it has a creates a risk for back problems is actually long-term truck drivers. And whenever I talk about this with people, um, it's a little counterintuitive. People think, well, how is truck driving like? How's that bad for your back? You're just sitting there. You're just sitting. Well, the problem is prolonged sitting and the vibration too. It really puts excessive wear and strain on the discs, especially if you're slouching. So chairs that are more supportive and more ergonomically designed are helpful, but prolonged sitting really is not very healthy for your discs. So prolonged slouching or leaning forward can lead to misalignment of the spine. This increases pressure on the discs, causes muscle imbalance, and this ultimately results in pain, stiffness, and higher risk of developing degenerative spine conditions. Certain lifestyle choices also can have an impact. In general, a sedentary lifestyle, we talked about, trying to remain active. A lack of physical activity can weaken the core muscles, um, which therefore results in less spinal support, increasing the risk of back pain and injury because of poor posture and reduced flexibility over time. Obesity, the less weight your back has to carry, the better off you're going to be. Carrying around excessive body weight puts additional stress on the spine. That leads to increased wear and tear, higher pressure on the discs, and a higher likelihood of developing degenerative patterns of wear and tear. We'll talk a little bit about certain spine conditions, one of which is disc ruptures or disc herniations. So people use a lot of different terminology. You've heard of a disc bulge, you've heard of a disc, you've heard of a protrusion, a rupture, or a herniation. And all of these terms really just describe um, different ways the disc can change. these different terms don't really suggest anything as far as the severity of the pain. Um, a disc becomes painful most of the time when it puts pressure on a nerve. So, um, for instance, I've seen people who have just a slight bulge in a disc, but if that bulge is right up against a nerve, it can hurt tremendously. And then on the flip side of the coin, I've taken care of patients who've actually had a big ruptured disc. And strangely enough, if it's not up against a nerve, sometimes it's not that painful. So I often tell people, don't get too tied up in the different terms: bulging, protruding, slipped, ruptured, herniated. Really, what matters is whether or not there's actually pressure on a nerve. Another common condition that we take care of, and maybe you've heard of, is what's called stenosis. Stenosis refers to narrowing in the spinal canal. So the image on the left is a kind of a more normal appearing spinal canal where you can see the nerves are free and clear and they have a lot of room to breathe. The image on the right is where the nerves are the the circles or the bundles in the center, where they're being compressed or they're being crowded. Um, and anything that takes up space inside the spinal canal can cause spinal stenosis or cause narrowing. Discs, bone spurs, calcium deposits, cysts, tumors, fractures, infection. Stenosis in general is just a broad term that refers to narrowing in the spinal canal. Now, most often, what we see is the most common cause of stenosis is just degeneration, where you form bone spurs and calcium deposits that build up in the spinal canal. Um, and then some other terms, people might have heard of scoliosis or kyphosis. Spinal deformity usually can be termed either as scoliosis or kyphosis. Scoliosis is where there's been a sideways curvature of the spine, and this is illustrated on the left. Kyphosis is, you could call that being more round backed, but that's where there's a curving of the spine that causes bowing or rounding of the back. Um, Another thing that's interesting, a lot of people have heard of scoliosis, and normally when people start talking about scoliosis, what comes to mind is the scoliosis that we're familiar with in teenagers or children or adolescents. And uh, you might remember school screening, where the school nurses would screen for scoliosis, or nowadays more commonly the pediatricians will screen for scoliosis. So when the word scoliosis comes up, people automatically think about that condition which occurs in children. Um, the most common cause of scoliosis, though, interestingly, is not adolescent scoliosis, which often comes to mind. The number one cause of scoliosis is actually arthritis in the spine, or what's called degenerative scoliosis. Degenerative scoliosis develops because as arthritis affects the discs and the joints in the spine, that can lead to settling of the vertebra. And because of the settling of the vertebra, then curvatures or deformities will develop or may develop. Another term, it's a longer word, but spondylolisthesis is a term that refers to slippage of the vertebra. Um, Spondylo is the Greek word for vertebra, and listhesis is the Greek word for slippage. So the x-ray on the right, you might be able to pick up on, if you look at the squares, which are the vertebra, there's one square that looks like it's really offset. and that's a slippage that we call spondylolisthesis. Spondylolisthesis can occur from injuries, but most commonly, again, interestingly, it's most often caused from arthritis and degeneration. Uh, Similar to the curvature that we talked about when degenerative scoliosis develops, as arthritis attacks the joints in the spine, that allows for slippage. Sorry, I advanced the slide too quickly there. Let me just double check. Yeah. So the early treatment for back pain focuses on trying to decrease the pain and the inflammation that can occur. So medications such as non-steroidal anti-inflammatory drugs, or what are called NSAIDs, those are the over-the-counter medications that people think about: Advil, Motrin, ibuprofen, Aleve, naproxen. Um, if you can safely take those. Also, steroids. Um, and then sometimes muscle relaxers can be prescribed to try to help if you're having muscle spasms. Um, Also, sometimes we will focus on trying to help with nerve pain. So, there are certain medications that are specifically designed to help with nerve pain. I call those adjunct medicines, but those medicines are one is called gabapentin or Neurontin, one is called pregabalin or Lyrica, one is called topiramate, which is also called Topamax. But those medications sometimes can be used to treat nerve pain, and they can be helpful. Also, sometimes we will have to use narcotics in certain select cases to try to help relieve pain if we can. Um, Narcotics are generally, we try to avoid those if we can. They should be used sparingly. And then the initial treatment for back pain also includes physical therapy and/or chiropractic care. Um, Certain modalities such as heat and ice therapy, um, exercises and stretches that are designed to help relieve the tension that can develop, muscle stimulation, deep tissue massage, traction, what's called manual therapy or manipulation, and then acupuncture or dry needling. These are all different things that physical therapists or chiropractors might employ to try to help improve your situation. The image on the right, or the illustration on the right, is what's called an inversion table, and really this is seems a little barbaric or maybe archaic, but this can help a lot of people. But basically, you hang upside down, and then it uses the weight of your torso to try to separate the vertebra in the low back. And for certain conditions, it can actually be really soothing for some patients. And this is a modality that sometimes can be used by chiropractors or physical therapists as well. It's just a form of traction. Some other non-surgical treatment, um, certain injections can be used to try to minimize pain and inflammation by targeting the source of the pain. Um, you might have heard people talk about spinal injections, what are called epidural steroid injections. This is a treatment where um, these are very precise injections done under a live x-ray machine, where you try to bathe the nerve in steroids to help get the nerve to calm down. The x-ray on the right is um, maybe a little confusing to the untrained eye, but um, that is where that's one of these injections being performed, and there's the small dark line is the needle, and then we've injected dye to make sure that the dye is coating the nerve. That might not project very well, but and then there not all spine injections are created equally, or there can be other options. There's another injection treatment called a medial branch block or an ablation. And this is where you target another possible source of the pain, which is the facet joints. So the facet joints are the joints that are in the back of the spine that also help with movement and rotation. Um, Unfortunately, those joints can develop arthritis as well and can cause back pain. And if that's the source of the pain, sometimes we can target those joints with certain specific. And then surgical treatment. There's a lot of different surgical options, but if you narrow them all down, there's usually one or two objectives related to the surgical management of the spine, and that's either a decompression or a stabilization or a combination of both. So a decompression, the goal of decompression is just to relieve the pressure off of the spinal cord or relieve the pressure on the nerves. Um, or anything that can take up space in the spinal canal can put pressure on the nerve. So discs, bone spurs, calcium deposits, cysts, fractures, or tumors. The image on the right is an MRI where um, uh, if you can appreciate the column where the spinal canal is, and then there's a dark structure inside the spine or inside the spinal canal. That's actually a disc that is taking up space in the spinal canal and putting pressure on the nerves. Sometimes the surgical management can involve stabilization. Um, at times we may have to add support or stabilization to the spine, and this is commonly referred to as a fusion. Um, Sometimes deformity or instability in the vertebra can demand the need for stabilization, fractures or tumors or severe degeneration. Um, Sometimes I like to talk about, um, when you look at the X-rays on that are displayed here, the image on the left is where you can see a shifted vertebra. And then on the right, that is after surgery, after we've stabilized that shifting. And, at times when people talk about rods and screws, titanium, um, you know, I have to acknowledge that these things kind of sound barbaric. Like, does it sound good to put titanium rods and screws in somebody's spine? Um, it just sounds a little barbaric. And I think it helps at times when I'll explain to patients that the very first surgeon who ever considered doing a spine fusion was Dr. Russell Hibbs back in 1911 at the New York Orthopedic Hospital in New York. And back in the early 1900s, uh, spine deformity was a big issue because of tuberculosis and also poliomyelitis. So, um, a lot of patients back in the early 1900s dealt with significant spinal deformities from tuberculosis or polio. And Dr. Hibbs looked at what was the body's remedy for bad cases of tuberculosis or poliomyelitis. And what he realized is the human body's fix for tuberculosis was to fuse the spine. Um, the way the body treated TB of the spine was to form bone spurs and calcium deposits that would knit the vertebra together and essentially fuse the spine. Now, the problem is it took the body years for that to affect that process. And Dr. Hibbs had a little bit of a brainstorm, and he said, "I can do that surgically." So um, the first spine fusion was done in 1911 for tuberculosis, and Dr. Hibbs performed an operation where he went in and put bone graft and laid it around the spine and then put the patient in a body cast. And as that healed, it actually worked. It successfully fused and stabilized the spine and helped treat spinal tuberculosis. Um, so nowadays, we don't use body casts, we use internal bracing, which is where the rods and the screws come in. Um, so as much as I realize that, using instrumentation in the spine kind of sounds barbaric, it's really just some of our best technology to try to help add stabilization to the spine and help uh, heal a fusion. And then sometimes the surgical management can include doing a combination of both getting the pressure off the nerves and stabilizing the vertebra. This is a case of a badly degenerated spine where there's shifting and settling of the vertebra, scoliosis, pressure on the nerves. And so the surgery involves both getting the pressure off the nerves and then stabilizing the spine. Um, and then, so the, you know, this X-ray will be an example of a maximally invasive surgical treatment. There are also some minimally invasive options. The illustration on the far left shows the use of a tubular retractor, which is basically like a tube that allows you to make a small incision and then uh, trim or shave the disc to get the pressure off the nerve. This is what's called a microdiscectomy. The center uh, image is actually a picture in surgery. This surgery is done under an operating microscope, um, but basically with the use of these small tubes and specialized instruments, we can get in there and safely get the pressure off the nerves by removing the rubber. And then the last image on the far right is a photograph of the size of that healed incision. And then there is some other exciting technology that is evolving right now related to, rather than fusing the spine, trying to preserve motion. And this is an X-ray of a patient who's had disc replacement surgery. You've heard of hip replacements and knee replacements, and that's what we do for severe arthritis in the hips or knees. Now our technology has advanced in certain cases to allow us to perform disc replacement surgery. Um, the insurance companies are very selective about which patients could be possible candidates for this surgery. But there is some exciting technology that's evolving right now related to motion preservation. So now I wanted to open up time for anybody to ask questions, if you have any.
Absolutely. Thank you, Dr. Stem. That was lovely. And I definitely learned a lot about my back health and also made sure I was, sitting up straighter after hearing about the importance of all of that. Besides the things you mentioned about the core, the exercising, core stability, the cat cow, someone's asking anything specific to prevent disc degeneration.
Thank you. And I was going to try to get back to, well, I'll just leave this up. Thank you, Delaney. So the question was, is there anything we can do to prevent disc degeneration? This is a great question, and unfortunately, a frustrating answer. There's a lot of research right now that's going into trying to figure out either how to prevent disc degeneration or how to reverse disc degeneration. And unfortunately, nobody has yet cracked that nut. And even with some exciting advents in our technology, like the use of stem cells. Um, um, Unfortunately, in other countries, um, specialists, spine experts are trying to um, experiment with the use of stem cells or other things that could be injected into the disc to try to help improve the health of the disc or to try to help reverse disc degeneration. And unfortunately, nobody has yet really been able to find anything that has proven to be effective as of yet.
Okay, that's good to know. So basically want to prevent as much as we can, right? Using all those cat cows and things like that. Um,
That's correct.
let's see. Someone also is saying the muscle stimulation for the treatment that you mentioned, would that be TENS unit?
Yeah, good question. So back in the old days, a TENS unit was something that had to be prescribed by a physician, and then it usually was outfitted by a physical therapist. And those TENS units do still exist. Um, but what's interesting is now you can get them almost per se over the counter. You can order them on Amazon. Um, and also you can get some over the counter, like Icy Hot has an over the counter device that's called Icy Hot Tens, and it's actually a component that's sold, over the counter as a device to help with muscle stimulation. Um, and that is muscle stimulation is also a technique that can be utilized by a physical therapist to try to help relieve some tension in the muscle. So I think that answers your question.
Right. Okay, thanks. How about, can your opinion and can you speak on the role of chiropractic for pain management when it comes to backs?
Yeah. A lot of people think that there's some animosity between doctors and chiropractors, and um, I don't really share that opinion. I think that um, really in all walks of life, there's good and bad apples in every bunch. I mean, there's good and bad cops, there's good and bad lawyers, there's good and bad doctors, there's good and bad chiropractors, and so um, I've certainly seen chiropractors help a lot of people. In my practice, um, because I'm trained in traditional medicine, and I'll say that chiropractic care, in the eyes of a lot of people, and maybe more importantly in the eyes of most insurance companies, it's probably considered to be non-traditional treatment. But in my practice, I typically try the more traditional methods. And I also, if I do refer somebody to chiropractic care, which I often do, I always want to I want to know what their spine condition is. So I want to have an MRI of their spine first before I refer them for chiropractic care. Um, and that's just because some of the more high speed manipulative type chiropractic care that some chiropractors can render, I worry about, potentially injuring somebody if there's severe pressure on the spinal cord or severe spinal stenosis. That would be a patient that I would probably try to shy away from some of the high speed manipulative type stuff.
That makes sense. Sounds like it's case by case basis, of course. We have time for one more question. What are your thoughts on vibration plates?
Um, Vibration plates. I guess I would say I think I understand the question, but I'm not that familiar with the role of vibration plates as it relates to mental health. So I don't know if that audience member could maybe further elaborate on the question.
Yeah, Tracy, you wouldn't mind if you have a little more detail on what you mean, maybe as like a treatment method. Let's see, he said yes, like as a treatment method, so something maybe also non-traditional.
Yeah, I have to admit, I'm not that familiar with vibration plates, for spinal therapy. So I guess um, maybe I would have to just say I don't know that I can comment on that.
No problem, that makes sense. Well, thank you, Dr. Stem, for this wonderful presentation. There's lots of comments in the chat saying thank you, fabulous presentation, and everyone appreciates you. So thank you so much. Thank you, everyone, for being on today as well. Our next BayCare Presents is on the importance of sleep on December 10th. So thank you again, Dr. Stem, and hope you all have a great day.
Thank you.